In this section that is brought to you by Adapt Pharma, I'd like to discuss how to initiate the conversation with your patients. The word overdose can have a negative connotation, and patients who take prescription opioids may not relate to it or think it could not happen to them and dismiss it. Therefore, when talking to patients, consider using language like accidental overdose, opioid safety, bad overdose reaction, or opioid emergency. Other sample conversation starters include: too much opioid medicine in your system can affect your breathing, which can be a sign of an opioid overdose. Opioids are a part of your therapy but can sometimes cause bad reactions. Treating your chronic pain requires opioids. Let's discuss the benefits and risks associated with taking opioids. Taking opioids in combination with other medications or health issues may increase your risk for an accidental opioid emergency. Do you have a plan in place in your home in case an opioid-related emergency occurs? Is there a family member, caregiver, or close friend who can help in case of an opioid emergency? Now let's review some possible patient interactions. In the following scenario, we will demonstrate how to counsel your patients on the use of Narcan nasal spray. I see your opioid pain medication dose has increased from your last prescription. This increased dose may put you at risk of an opioid emergency. As a safety measure, the CDC guidelines for prescribing opioids for chronic pain recommends healthcare providers offer naloxone to patients when factors that increase risk of opioid overdose are present, such as a higher dosage of opioids.
What is naloxone?
Narcan nasal spray is a leading brand of naloxone for community use and is administered in the nose. It is a potentially life-saving emergency medication and is used to counteract the effects of an opioid overdose, which may include the slowing or even stopping of breathing.
Okay, how do I get it? Do I need a prescription from my doctor?
No, you are able to purchase Narcan nasal spray at the pharmacy counter without an individualized prescription from your doctor under the statewide naloxone standing order. Remember to administer in accordance with the instructions for use. Narcan nasal spray is not a substitute for emergency medical care. Repeat doses may be necessary. In this section that is brought to you by Adapt Pharma, I'd like to discuss how to have the conversation when your patient brings you that new Narcan prescription.
Hi, I am here to fill these prescriptions, but my doctor also gave me a prescription for naloxone. What is it, and do I need it?
I see you have a new prescription for an anti-anxiety medication, clonazepam, which is a benzodiazepine. This medication in combination with your opioid medication may increase your risk for a serious, life-threatening opioid overdose. The CDC guidelines for prescribing opioids for chronic pain recommends co-prescribing naloxone for patients who are taking both types of medications. This is why your doctor gave you this prescription.
Is this something I can administer to myself?
No, it needs to be given by a family member or friend if an overdose emergency situation occurs. They should know where it is stored in the house and be familiar with the signs of an opioid overdose. Narcan nasal spray is not a substitute for emergency medical care. Repeated doses may be necessary. Is there a family member, caregiver, or close friend who could help in case of an opioid emergency?
That would be me. Can you tell me what to look for?
Yes, a major sign of a possible opioid overdose is being unresponsive, but other signs may include excessive sleepiness coupled with unresponsiveness, breathing difficulties such as slow or shallow breathing. The black circle in the center of the colored part of the eye is very small. This is sometimes called pinpoint pupils. Keep the patient under surveillance and be sure to get emergency medical help right away after giving the first dose of Narcan nasal spray. Repeated doses may be necessary. As an additional resource, there is a how-to-use video found at narcan.com. In this section that is brought to you by Adapt Pharma, I'd like to discuss how to have the conversation when your patient asks about Narcan nasal spray.
My mother's on opioid pain medication, and someone told me I should be looking into getting Narcan.
Can you help me?
Why, yes, we do have Narcan in stock. Let me get the pharmacist.
Sure. Your mother's opioid medication puts her at risk for an opioid overdose. Narcan is administered intranasally if someone accidentally takes too much of their opioid medication and can't be woken up. Narcan was designed for non-medically trained individuals. Once you have identified a potential opioid emergency, lay the person on their back. Remove the device from the packaging and hold the device with your thumb on the bottom of the plunger and 2 fingers on the nozzle. Insert the tip of the device into either nostril and press the plunger firmly. Once Narcan has been administered, watch the person closely and call for emergency medical assistance. Repeat doses may be necessary. Administer Narcan nasal spray in alternate nostril with each dose. It's important to note that there is only one dose in this device. You do not need to prime it.
That sounds good.
Be sure to read the patient leaflet and to review and follow the Quick Start Guide for instructions for use. Narcan nasal spray is not a substitute for emergency medical care. Be sure to call 911 after giving the first dose and monitor the patient closely to understand if CPR is needed. Repeat doses may be necessary until medical help arrives. Pharmacists can have a positive impact on the harmful effects of the opioid overdose epidemic and should be prepared as patients may be interested in additional education or have questions on how to recognize an opioid overdose. To obtain educational information for your patients, please call 844-4-NARCAN or email customerservice@adaptpharma.com. By continuing to provide essential education about the proper use of opioids and overdose recognition, pharmacists may be able to reduce the risk of overdoses among their patients and in their communities. And remember, even if patients think an opioid overdose can't happen to them, reiterate the importance of being prepared with Narcan nasal spray. Thank you for watching Narcan nasal spray pharmacy education video, and be sure to have the conversation with your at-risk patients.